back again with another episode of Clinical Conversations, and we have Stephanie May, occupational therapist and clinic manager at CORA Physical Therapy, back again with us, and we have Ashley Langford, director of clinical excellence at CORA Physical Therapy, but also our director of the Institute for Clinical Excellence at CORA Physical Therapy. And I am Adam on the marketing team, and today we are talking about being a mentor in the clinical setting. And I think Ashley and Stephanie are both probably two of the most sought after mentors, probably in the industry of OT and PT. And so I'm interested in hearing more about what makes them tick and what makes a great mentor and why mentors are important in the clinical setting. So take it away.
Go ahead, Stephanie.
All right. So what I'll say is I love being a mentor. When it comes to the patient side of life and they're like, well, why should I care about mentorship? I'm just going for the therapy. I love it because not one person knows everything. So if you have a mentor, if you have a group of people that are working collaboratively, it's only going to make your treatment and your care that much better. And I love it because I can see the therapists grow when they're treating the patients. They become more comfortable. They're not searching and they're not self-conscious of what they're doing because they know that they have someone there to help them and whisper in their ear, be like, hey, do this one, or hey, do that one. So it's nice. I love being a mentor. I love watching people grow, both patients and clinicians. What about you, Ashley?
That's great. Now, I think this is a great topic to talk about because I'm just thinking about my PT upbringing, and I don't think anything takes the place of mentorship. You know, at the end of the day, if you're, there's multiple reasons that you should want to be mentored, and really there should be no point where that stops either, because there's something you can take from everyone.
Yeah.
But mentorship is where the magic happens. You know, stepping in and taking a course, even if it's in person, you're lucky if you're able to walk away from a course and go, oh, I've got a handful of new things that I want to try. But to me, the magic is, we all come out of school and we hear about rehab from point A to point B, but experiencing it and then at a high level, sometimes if you're in the clinic with Stephanie, she's going to do something in front of you, and right after you're going to go, holy crap, what did she just do? That's amazing. This person isn't in pain, or now they can make a fist, and if you're in this profession, hopefully everyone is, because you want to help people. There's nothing better is when you pick up on some form of magic that you can then use with you into the future and teach. And I think being able to mentor someone else too is just it's hopefully you love doing it, because if you're going to be at work, why not create those fun interactions, support other people, and give back. I think without it, I think work would be super boring because you're going to do the same thing over and over again and you won't get the results. It's also how you empower yourself over time to become, the better you are at something, the more efficient you are. And particularly if we're talking outpatient setting where it can be busy, it just becomes more doable. There's a lot of people that just kind of fake it till they make it every single day. And that doesn't sound fun to me.
No, I agree. So the mentor creates the safe space, right? They're the non-manager support mechanism. Quickly, I think both of you have managed a clinic. I think, Stephanie, you are clinic manager. Ashley,
Yep,
I think
senior clinic manager.
Yeah, so difference between manager and mentor. This is a little bit of a curveball here too. We're not talking about being a manager, but it's important, I think, perhaps there's elements of being a mentor that you can apply towards being a better manager.
Mm-hmm.
It's a good one.
I would say in terms of manager versus mentor, I'm using that relationship to watch somebody's skills grow. And I want to see them blossom as a therapist in a way of critically thinking, a way of problem solving, and a way of helping their patients get better. And obviously, as a manager, I want that as well. But as a manager, I trust that you already have some of those skills to continue. But then that's where like your manager and mentor gets meshed together, because if you have that mentor heart, I still want you to grow as a clinician, and I still want you to increase those basic skills as a manager to make sure that your patients, even though you may be taking care of them on your own, hey, how's it going? Or like, hey, were you stuck on this? I want to create that, like how you said, that safe space that like somebody can come to you and ask you questions on maybe a patient that I've never treated before, you know? But ultimately, it's all within one clinic. So it all creates a cohesive experience for the patient.
Yeah. Ultimately, it all supports each other, right?
Yeah.
There's one, and some of it's what's in your head, and recognizing that's really important. But at the end of the day, it's the feel of it. The mentorship is typically something that you had a love for personally, and now someone else does,
Mhm.
and it's just fun to share that. Sometimes it can be a little awkward when you got to give direct feedback, like mentorship or management. Management is going to be, you're managing through a larger organization or your company, and it's you're bringing in more elements. But I think, to me, what I've always enjoyed is they should connect, like, because they do support each other, and so often they disconnect, right? We're emotional human beings, and that's natural. But the reality is, it's fun to take, for example, like something I used to love talking about was such a nerd, but like billing. You can sit here and you can talk about, oh, well, what code are you billing for your therapeutic activity or exercise, and it has a number, and it just seems very like business oriented. But in reality, that code represents what treatment you just provided
Yeah.
that we love, and we were just talking about it. So it's the same damn thing, but it appears very different.
Right.
So
It's the approach.
you could probably be a good mentor without being a manager, but
Yeah.
can you be a good manager without being a good mentor?
I don't think you would be the best manager. I think you can still be a good manager. Because like how Ashley was saying, there's different aspects that also come into play, like the business side of things. But will you be the best manager? Probably not.
I'm
Not
going to
if you
say,
don't have the mentorship part.
for Stephanie and I, will say no, but you might take others that are like, yeah, you're a great manager. You got to
That was my
find
only
the right mentor.
that was my only tricky question. I promise. That was
That
kind
was
of another curveball for you. Okay, well, what about quality? Say you were, you're both good mentors, and you're looking for a mentor. Maybe you have one still. What are the qualities that you look for in a good mentor?
For me, I think a mentor should always have a learning mindset. They should be humble enough to know that they don't know everything and that there's still so much out in the world to learn. But when they learn, they get so excited that they want to teach you, and they want to teach their team, and they want to teach the world, like, guess what I just learned? I learned how to bend the finger so hard that now they are making a full fist. But
I'm getting excited just listening to Stephanie talk about this mentor.
but you do, like, you just want to have that passion, you want to have that learning. Whereas if I go to someone and they're like, okay, today we're going to learn about the wrist, and tomorrow you're going to learn about the elbow, and I'm going to test you on it, like, that's not fun. Like, you're not going to be excited about that relationship, and it's not going to excite the mentee into further learning. They're going to say, like, all right, well, this is what I have to do because my mentor said it. And it's not going to excite them to grasp that more.
I think that also taps into what really makes this profession, or just healthcare in general, cool. You have such an impact on your patient community, but when you elevate yourself to become a fun, exciting, inspiring mentor, you have a ripple effect across the clinical community as well.
Yeah.
And now that, I mean, the ripple effect is just that much farther. It's
Yeah.
really cool. It really is.
But like also going off of that, sorry to interrupt you. I'm getting passionate now. But like not only do you have effect across your coworkers and like the people in your profession, you have a ripple effect on yourself. Because when you verbally are saying things, when you verbally are teaching, you only are reminding yourself of like, oh yeah, I forgot about that shoulder thing that I can do. Let me teach you that. But then it just makes you a better clinician personally because you have to problem solve even more, but then teach about it.
Like when I go back to the math homework that my kids have, and I'm forced to try to remember some of the algebra. Yeah, good.
Math these days is different. It's different now. It's okay. You're learning something new.
I'm going to say Stephanie hit it right on with the way what I would look for as well. I mean, I was thinking humble in my mind, lifelong learner. So it's kind of interesting to hear you just kind of nail it. So.
But they have to be motivating too. Yeah, that's what you said.
Yeah, they have to bring an experience. Like,
yeah.
you know, bring an experience. They've obviously got to have something that they're willing to offer, something new for you that you find valuable. But yeah, they got to put on a show.
And there's that intrinsic motive. I mean, you become a member of the healthcare, provider community or employee of healthcare providers because you have that intrinsic motivation to help others. And I'm sure it's an easy carryover if you can just kind of like bring that energy forward with you to help others on the clinical side and of course on the patient side. So any final words on that? I liked the conversation. That was good.
I might even bring up a kind of a thought question here to go off of is when you're looking at mentorship too, I think, recognizing particularly in the like physical therapy outpatient or physical therapy, occupational therapy setting, it takes a long time to become an expert in a field, right? So that plays into the mentorship is recognizing that, I don't know what pops up in your head, Stephanie, but I think to myself, investing 4 to 6 years in an area and working on something, because it's not just about a certification or it's time that you develop that ability to recognize patterns and put on that show that your patients need to buy into as well.
Mm-hmm. Yeah.
Okay, wait. I have another question. It's another spiked question. Okay. Can an OT mentor a PT and vice versa? Is it like, oh, no, I'm not, you didn't go to school for it, therefore stay in your lane, I'll stay in my lane, or is it mutually beneficial?
I'll start as the PT.
Go ahead.
OTs, you ready? I'm gonna say it slowly so that you're waiting on it. OTs should mentor PTs. They come out of school with a different perspective of such value. And I realize this because it didn't take but like one course we offered that it was PT designed, PT taught, and I got like an earful in a positive way of the way it was presented, what was missing, and it was like, holy crap, you're right. So yes, 100% there's value. I think that should be everyone's experience at any point is learn from your OTs.
Yep. Good answer. That was the correct answer, Ashley.
Pay me after, all right?
I wholeheartedly agree that there should be in all the settings, in the outpatient setting, in an inpatient setting, acute care setting, I think that there should be cross mentorship. Same thing how Ashley was saying. Like, all right, don't get mad at me, Ashley. I like to say that physical therapists have a very mechanical mindset. Like, okay, this is how A, B, and C works, and this is how it works together. Whereas like OTs have that holistic mindset of like, oh, it's all working together, so now we can do this particular functional movement. Even though we have those same mindsets and the same goals, I feel like PTs just think that way more often, and then OTs think that way more often, right? So when you have that cross mentorship, it mixes, and it's such like a cohesive like light bulb of like, oh my gosh, I didn't even think of that. Like if you're treating something down the arm and the PT says, oh well, it's because of their cervical level and something's going on at their spine and it's XYZ at their spine. I'm like, oh wow, like light bulb.
And the OT, correct me if I'm wrong, but their immediate thought too is, what is the person coming in for? What are they looking to get back to doing? Let me watch, how are they doing it? And it's changing the way I think about how courses should be written and put together. Because, Adam, one of the best ways to learn is learning it in a manner in which you would actually see it in real life. So like if you're about to teach about cervical radiculopathy issues coming from the neck going to the arm, start with Jill, who's 37 years old and has a dog that she can't pick up or blah blah blah, and like it really, it's such a beautiful way of learning. So I think the two professions really blend nicely together.
Yeah.
Well,
you will
this
have
was,
some pushback.
oh, that's what I was hoping you'd be kind of like, well, that's my lane, that's your lane. I was hoping for a little,
We've fought it out in the past. Now we're good.
Yeah. Now, I
No,
will
great.
say that like if we see that in the clinic, it's nice to have that light bulb of like, oh, okay, it's coming from the cervical level. It's not down at the hand level with carpal tunnel. I'm going to refer my patient now to physical therapy. And I think that's where that cohesiveness fits in the clinic of I know PTs have a better understanding and a better education to treat this. So I'm going to, for the betterment of my patient, send them to physical therapy instead and see if something can be done from their perspective.
And that trust comes from the collaborative mentorship. That's to bring it all back, right? Just to work with them, understand them, appreciate them, and kind of bring that back to working together and providing a better patient care experience.
That's it.
Yeah. And Stephanie, myself, and several others have all been working on a certification track that encompasses all of that. So no matter what your background is or profession, it's gonna be much easier to identify these symptoms, where they come from, in that collaborative mindset and training. So
that would be, okay, wait, quick question before we fill. It's not related to mentorship, but this class that you just mentioned, of course, is open to PTs and OTs, not
and PTAs and CODAs as well. Yep.
Yes.
Okay.
We want everyone to learn.
Well, I learned a lot today. Two great mentors, two excellent clinicians, two really rock solid teammates, and it was my pleasure being able to listen to your talk about mentorship. Any final words?
Never stop learning.
Never stop learning. Okay. Hashtag.
I like it.
I'll include
lifelong
that.
Student.
Okay. Hashtag lifelong student. All right. Thank you very much. Rate, review, subscribe, listen to the next episode. Again, thank you guys. Thanks for listening.
Thanks, y'all. Be safe.
Bye.